Hello, my name is Dr. Hilda Rosselli. For years as a state policy analyst, I used data to inform decision-making and legislation. Like many of you, I found spreadsheets, line graphs, and dashboards helpful, but incomplete. This video on the coronavirus showcases an innovative three-dimensional data visualization tool created by my colleague Martin Kagan from Data Cocoon, which I'm eager to share. The COVID virus is providing a compelling example of the need to track, analyze, and project complex data systems on a daily basis. This data dashboard from the Johns Hopkins Coronavirus Resource Center uses heat maps, data tables, and interactive line graphs to provide information on confirmed cases, deaths, and recoveries. The Institute for Health Metrics and Evaluation at the University of Washington, with funding from the Bill and Melinda Gates Foundation, is using data from the World Health Organization, government agencies, and hospitals to produce daily projections on the number of hospital beds, ICU days, and ventilators needed. Many of these data representations are available individually by state or country, as shown by Bloomberg using the IHME data. Although valuable, there are limitations to the most popular data representations currently available. Raw data or tables of means and variances are not as insightful when hierarchical data are encountered. The quantity of data that can be presented in a single image is limited. Sites attempting to track multiple countries or states are often hard to read and less likely to be interactive across time. And lastly, interrelationships between variables and data sets cannot be entirely presented with a simple image. Using a patented data visualization tool before your eyes allows the user to simultaneously view asynchronous multidimensional data, literally before your eyes. The software allows rotation of these figures on a computer screen, thus allowing comparison of different branches and their relative sizes. For the past 6 weeks, Data Cocoon founder Martin Kagan has been actively tracking confirmed COVID-19 cases, admissions, recoveries, and deaths with renderings that are further ahead of what others are able to currently represent. He is now making this same tool available to researchers and policies to extend the reach and breadth of the current COVID-19 IMHE data. As you can see, before your eyes presents the data in a circular pattern, placing the data along a spine with elevations representing individual data points. The visualization is far more compact than a typical spreadsheet and allows data to be easily compared to one another over an extended length of time. Similar branches can also be compared based on the pattern differences visualized along the central axis. Using visualizations like this also helps to detect data errors more easily than via a data spreadsheet. If the pattern is suddenly broken, then one can easily see that one of the numbers is incorrect. And like other useful models, Before Your Eyes is able to track a multitude of dimensional attributes, in this case, admissions, datas, beds, recoveries, and death over time. And rather than showing each country or state individually, one can see every country's total means, as well as upper and lower bands using 3 cylinders. Here we see the same type of cylinder on the right showing cases across almost 190 countries. And on the left side, an added feature is a global array arranged by continent, region, and country, showing proportional data value relative to each area's density of population. To take this further, I'd like to invite Martin Kagan to walk us through some of the newer developments in Before Your Eyes. Martin?
Hi, thank you to Dr. Rosselli for that fabulous introduction and overview. What she discussed, we're going to be looking at in greater depth. and I'm trying to get a handle on the new Cartesian plane that you see in front of you, as well as how it integrates with what you saw prior in terms of the time barrel. Observe, if you would, for a moment, just to get an orientation of what we are talking about. This isn't some type of drawing. This is actual interactive data. Each point here is specific and specified. In fact, what you're looking at is the globe. 180 countries of the 260 odd positions are all positioned here accurately and consistently. So in essence, we're looking at a globe slightly differently. We have the 6 continents, North America, and obviously the United States. We have Asia and all its sub-regions, and every country within that sub-region, and that for Africa and for Europe. And obviously this matrix stays consistent, as the globe does. But what changes is values in time. What we're looking at is a concept called relative value. It's a terribly important aspect in consideration of the epidemic. We are looking at countries as per the proportionality of the outbreak relative to the country itself, even before we apply, as we can see here, the population density factor. So this is a fairly advanced graph. We take that one stage further, and we augment that graph once we understand and distill what its components are. Its components essentially is every single country over a period of time, much like a histogram, except what we're doing is we're looking at a specific point in time for all countries worldwide to get a holistic view of representation of value. With that said, we can compare that with GIS. GIS is useful to an extent, but when it gets to this stage here, where all you see is essentially a sea of red, we have lost the meaning of what this tool is able to provide. We are once again drawn to reading numbers and interpreting them ourselves. And having to go through that exercise is a laborious and time-consuming activity. It's like taking an entire data sheet and putting that in your mind for 260 odd countries, or alternatively for the 50 states of the United States. There has to be a better way. An advanced format, as was shown, is using the IHME's data, where every single point is represented for every single country. And we could change the country and see a different position, and it would adjust accordingly, as you just seen. But how do we interpret that? How do we see it in relative terms, and how do we see it holistically? There is only one way, and that is to use the tools that you've been shown by Dr. Roselli. The Rose model shows data over time in a histogram format for each country, all combined holistically. Combining that with the hexagram and getting a positional graph of the two playing interrelated positions would be optimal. And that is what we do within before your eyes. We're not only watching a static graph here in positions, this is a dynamic interactive graph, as you can envisage. But more than that, it takes multiple attributes and assigns them within the single holistic graph. We can follow and track occurrences, death, the mean, the upper mean, just as you saw in the HMI's data. And we are able to see that consistently for all countries at a calibration accuracy level to the millimeter. So if one takes that information and it says what can we best do with that in a different view of the same data, we could see this data interactively playing through time at different points and get a relative value point as you see it playing out here in front of you. And from that, get a better quantification of what these values represent in and over time. I'm going to go back for one moment and compare the original graph. Here you can see the interactive part of it taking hold. The play up here of confirmed cases recovered, and that's for Italy. So we are able to see such information holistically. Going to that original graph for a moment, we can see the interactiveness between the two different structures. Here we have, on an international basis, all countries in the world, and we focused on Europe in this case, and the 4 regions within Europe, and we're able to see how each country has compared. But note that they are interactive from the left-hand side to the right-hand side. You can see the changes having occurred. If we locate Italy, then we would see a very pronounced, obviously, growth in that factor. So, getting back to where we were and switching to the United States as a singular model. The United States is represented by 9 regions and the states within each of those 9 regions. And we're able to use the concept of the rose model and go back in time and see what the data proportionately represented in each aspect to get an exact quantification. Not only that, we've got a data interactive menu that gives us numerical values that interact with that. Here we're looking at, essentially, the 3 aspects of admittance from the mean, the higher, and the lower band. And we could look at that in a multitude of items. So thank you.
Thank you, Martin, for that preview on where the system is going next. And we invite you to review many other examples of the Data Cocoon 3D visualization on a YouTube channel. You can see applications of this in a variety of ways, including more on the COVID virus. Again, thank you for your attention. We encourage you to reach out directly for more information. Thank you.